Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Welcome to the Egg Whisperer Show. I'm beyond excited to have Dr. Deborah Simmons on with us today. Hi, Deborah.
Good morning. It's nice to see you.
It is so great to see you too. And we're going to talk about the best tips for surviving infertility. And literally, we need to learn your tips because survival is so key during what I like to call it the Odyssey, right?
Right.
So I want to tell folks about you. So you've provided specialized counseling for infertility-related trauma and pregnancy loss for more than 20 years. You received your PhD in family social science from the University of Minnesota, a master's degree in public administration from George Washington University, and a double major in international relations and political science from American University. You've worked with fertility clinics, OB/GYN clinics, surrogacy agencies, egg donor agencies from around the world. And you consult to the Center for Reproductive Medicine in Minneapolis. And you love helping people with decision-making about what path to choose to get to parenting. You provide psychoeducation to all who seek to be parents, whether this is by using IUIs, IVF, donor eggs, donor sperm, donor embryos, or gestational surrogacy. You're also the mother of 2 premature babies and a feisty veteran of months on pregnancy bed rest. I can only imagine how many and how feisty. And you're also the author of We Are Always With You, a love story for preemies and their parents. Thank you again, Deborah, for joining us. I'm so lucky to have you on today. And I want to hear more about what got you interested in this work.
Mm-hmm. Well, I always thought there was something going on with my body, but the doctors that I was working with were like, you're fine. I know that you don't have a period for 2 weeks and then not have it for 2 weeks. I always knew that something was off. So when I finally got pregnant, which was a surprise to me, I ended up delivering at 26 weeks. And I was in DC and I loved it there. And I thought, okay, career over. What am I going to do now? And I went to the University of Minnesota to get my doctorate. I was going to work in medical family therapy. And while I was there, my professor got a call from one of the fertility clinics in town and signed me up. So I felt extremely lucky that I was expanding my range in reproductive shittery because I thought that I was going to be working with preemie parents.
Did you just say reproductive shittery? What does that mean?
It means anything that's going on when you want to have a baby and it's not working. So it could be you're not ovulating. It could be that you have a miscarriage. It could be that you're doing IVF. It could be that you have a pregnancy loss, a traumatic delivery, a preemie, you name it. Anything that is outside of the realm of what we're supposed to do.
It's just all shittery. I love it. Okay. And so for people who might not be familiar with what you do, what is psychoeducation? And I love that term because it feels a lot better than, seeing a psychologist because you have a problem. Education just feels nicer. And why is it important for fertility patients?
Because often people don't know much about fertility and they don't know much about fertility treatment necessarily. So we're not here to diagnose people in the mental health world. We're not interested in stigmatizing. We're interested in saying, did you know? And let me help with this. And here's a handout. And then in the realm of third-party reproduction, we're talking not only about what people are going through now, but also about what it'll mean in the future when there's a child.
Yeah. I mean, I almost want every single patient to have a therapist that has a booked appointment with my patient on the same day that I give them their pregnancy test results.
Do you know how long we've been waiting for that? What you just said is the thing we want.
I know. And it, no matter if positive or negative, because with the positive comes additional anxiety. And as you know, with the negative comes depression, sadness, trauma. And then we stop taking care of ourselves and treat ourselves right. So
the first blood test is really nice. But then what?
Yeah, exactly. So much can happen. And why do you feel like it's important for patients to work with a therapist during treatment? And can you just share with us some of the benefits?
Sure. we know that people are suffering. And normally we would go to friends or family or coworkers or a religious person. But often what people get are like, that's not a big deal. You just need to relax. And so a therapist who's trained in this area is able to say, this is really hard. This is as hard as you think it is. And we're not going to dismiss your concerns. And it's an opportunity also to explore a little of the old stuff. So when you're feeling defective in your body, anything you've ever thought or felt about feeling inadequate, the not good enough monster, that'll come up in fertility. So it's an opportunity also to say, you're a good person and you have compassion for other people. Let's have that for yourself as well.
So true. I've also found that relationships are splitting up more than I've ever seen in my entire life. So I've actually introduced a new question during my new patient interview for people who are coupled. And I'm just shocked by the answers. And I'm just so glad that I came up with this question. And it's, what's the chance that you guys are going to be together in a year?
That's a great question. And it scares the jeepers out of everybody.
It does, because I've had someone say 30%, and then the other person had no idea that that person was thinking 30%. And I'm just like, oh shit, right? Like, I'm just so glad that I brought it up. And it actually, in this one situation that I'm thinking of, it actually brought them together and made them stronger so they could, figure things out so that they can be committed to one another and, their future pregnancy. But anyway, so if you're listening to this, please ask yourself that question.
If you were to ask that same question in an oncology clinic, what's the chance of you being with your partner a year from now after you've had treatment? We would be shocked, right? We would be like, what are you talking about? Of course we're in this. But somehow about fertility, we don't think of it as medicine. We don't think of it as a medical problem. And we think of being together as optional. When, my husband said to me one time, I read him the questions that I'll ask. Okay. Well, is this your first marriage? And he said, excuse me, this is the only marriage. And I started asking the question then, is this your only marriage? And I talk with people about what did you promise to each other when you got together? Did you say that if things are a little hard, we're just going to walk away? No, we said we're in this for better or worse, in goodness or good in health or poor health. And this is not I don't know, maybe I'll stay. I mean, it's just not that.
Right. You're so right. Because when someone gets diagnosed with cancer, you fight together.
Right.
And you're right. It shouldn't be optional. Yeah, that's really powerful. So what are some of the important things that parents to be should consider, especially around the best route for them to take in becoming parents?
Mm-hmm. Flexibility. It is important to even get your mind around the idea that if you're wanting to go this way, this is the way you expected to go, but your route is going this way. When you want it to come back to here, as much as I understand that, it's not going that way. And so we end up using energy to try and resist. And I understand resistance. I understand why it's there, because we don't want the story. We want the easy story. But I've learned over the course of my life that if we use the words, oh, this is what's happening. Oh, this is what's happening. We're able to keep going with what we want. We can grieve along the way, but we also might get closer to what we want.
I'm learning so much from you, Deborah. I feel so lucky to be talking to you today. Flexibility is a word that I think that everyone needs to use as a physician, fertility doctor, when talking to patients about being flexible. It's not about this is a plan, this is how it's going to happen, and you have this guarantee. It's about being flexible around what you might learn and how you're going to pivot around those things.
And we don't have to like it. We may be flexible enough to do plan B, but we don't have to like it if we don't want to.
That's true. That's true. My patients sometimes don't like the other plans, but later on they look back and they're happy. So you do a lot of work. Obviously, we've talked about relationships and how they play into the fertility journey and parenthood. And I would love for you to teach us a little bit more about how to navigate each of these and what our listeners need to know. Let's start with the relationship with yourself.
Well, I said before to please be compassionate with yourself. You would not say ugly things to your neighbor who is going through the same issue. So please be kind to yourself. The fact that you may be having a fertility problem doesn't make you a bad person or a less than person. It makes you a person. And so I think that, again, addressing shame and guilt and whatever inadequacy you may think you have, good, let's do that. But then there's also the flexibility of the mind. And I like to use what's positive neutral. So when we're going through procedures, I might say, well, this might not suck. Okay, I'm not saying it's going to work or it might not work. This might not be as awful as I thought it would be.
Oh my God, I love you. This might not suck.
Right, and that one came up from one of my patients. So ever since, that's the first one that I'll offer, and people laugh and they're like, "Yeah, it might not suck."
It might not suck. I can just see quote the T-shirt, the hat. You got it. Yeah. What about the relationship if partnered? How to navigate the relationship with your partner?
To look to one another, not past one another. So if you are in a place of absolute distress and your partner is feeling helpless, which is often how it goes, acknowledge that the partner feels helpless. And for the one who feels helpless, acknowledge that this one is in distress. We don't have to judge it. We don't have to do anything about it. But we do have to remember that each person is having feelings. I often hear that, my husband or my partner just doesn't ever think about this. And I've countered that. I was just at the Jefferson Infertility Counseling Conference about a week ago. And Dr. Brennan Peterson, who studies male infertility, said men are having all kinds of thoughts and feelings. They just don't express it out loud necessarily. And so I often have to tell women, please know that your partner is feeling all kinds of things. There's also a way that we can invite partners in to provide psychoeducation because they can take information, right? We don't have to talk about all of our feelings necessarily, although I'll tell you that it comes up a lot. I remember I used to work in a fertility clinic, and I sat down with a couple, and a woman said, my husband's been great for me. He's listened to me. He's been there for me. And I said, that's wonderful. And I turned to the gentleman who happened to be a police officer. And I said, I hear you're a great guy. Who's been there for you? And he burst into tears. Right. So I know that he was having all kinds of feelings. And he told me later that being acknowledged was hugely helpful, just to know that there was somebody on his team too.
Right. Wow.
So to be on each other's team, hugely important.
And what about relationship with your friends? Any tips about how to navigate that?
That one is a rough one. Normally, again, you look to go and take your thoughts and feelings to your friends, and they're great. Except on this one, what they often have is advice, or they'll say, I don't know what to do. And so how about we go shopping? It's just like a complete dismissal of all of it. And sometimes we have to train other people to say, I'm going to tell you something, and I just need you to listen. Then friends can hear it. Sometimes you invite a friend to the clinic because they really don't know. How could they know? They're not in it. And then sometimes if you were to draw a target, okay, with you in the middle, you would normally expect those friends to be right smack in the middle with you. But often the friends are way out on the outside. And so it will reorder friendships sometime, especially if your friends are popping out babies like popcorn and they want you to be a part of it. And which I understand. They want you to share in their joy, but if you can't, you just can't. You look for the things in your friend that you can get and the things that you can give.
Right. Popping them out like popcorn.
Right.
Those damn popcorn machines all around my patients.
Yeah, and you hear them all the time.
Hear them all the time. That's so true. And it's just so loud in the ears of my patients. And it's so hard for me to see that. And I have a rule in my practice that the only baby shower that you're allowed to plan or go to is your own. As women, we force ourselves to do things because we feel like people are going to be upset with us. And no man would go to a baby shower if they don't want to, right?
My special word for that?
What?
Diarrhea. So that if you go to the baby shower, because maybe that morning you think you can, but then it becomes too much, you go in the bathroom and you sit there for a while. And you tell yourself, I'm having diarrhea. So I don't have to explain that to anybody. I just don't have to be out there right now. I need to be right here.
You don't tell people you have diarrhea when you have diarrhea. You just say, just not feeling so hot.
Yeah.
What about relationships with coworkers? What kind of tips do you have for us about navigating those?
That one's tricky. People have such a good work ethic. They don't want to put extra work on their coworkers. They don't really want to tell their coworkers because they don't want to hear the same stuff they hear from their friends. They don't necessarily want to tell their boss because the boss says, well, you still have to be here to do X, Y, Z. Okay. Some of that is also fear. It's anticipatory fear that they're going to get a bad response. And they really are afraid of losing their jobs. Now, I don't think that they will, but the fear of it is what drives a lot of this. So when people have, in fact, told their supervisors, for example, I'm having some medical problems, I'm going to need to be away from the office. Vague truth goes a long way. The employer doesn't have a right to ask, and it gives you a little bit of room. With coworkers, you're like, oh, you're away so often. The answer is, yes, I am. I'm having some medical problems. Kindness goes a long way.
That's nice. Kindness goes a long way. Or you just tell them you're having diarrhea. I'm just kidding.
Exactly. A lot. Yeah.
A lot of frequent diarrhea. We've been through so much in the last couple of years, as you know, and I'm sure you see that with your patients and the experiences they share about the amount of stress that they're under. And I feel like tip 2 on your list, 10 tips to survive infertility, which is infertility is as difficult as you think it is. You are not making this up, is so relevant right now. What people need to know, what do people need to know now that we're living during a more stressful time?
That kindness goes a long way. The last few years have been awful in lots of different ways. COVID, people getting sick, people dying, people being closed out of clinics in May of 2020 who felt like they were running out of time, feeling set back or another hurdle. Remember what I said about, oh, this is happening, this is what's happening? That would be another way to go about it too. That we're not going to fix what's on the television. We're not going to fix what's in the world. We can only take care of ourselves and control whatever we can control. And I think that helps a huge amount to set expectations in a way that can be dealt with. You know, it may be 3 months until you get your treatment. It may. And the world is not ending. And the world is not going to end, at least not because of the fertility journey. Now, the rest of the stuff that's going on in the world, maybe. But it's keep it local. You know, keep it within yourself. Keep it within your partnership. Keep it within your household, because that's where you have some control. And I'll tell you what, there have been days over the last couple of years where at the end of the day, I lay down on the carpet in my room and I do Shavasana. I just, the last pose in yoga, and I get grounded again because I don't know that I can get out of the building. I have to re-get my resources back to be able to let go of what I can let go of, and then also to keep going. And so in the fertility world, you need to get your resources back in order to cope with stuff. Maybe you take a month off from your treatment, even though it might feel like a year. Maybe you do something silly like, oh my gosh, like go to a B&B and sit quietly. Maybe read a book. Maybe do something that is bringing you something.
Well, I listen to trance music when I need to recenter myself, literally. And my husband laughs at me because he's like, how is that relaxing? It's just, and I'm like, I don't know why.
Yeah, I'm a stress baker. The people in my family are very fortunate.
Well, thank you, Deborah. I could literally sit here and talk to you like all day long. I can totally see why people love you. And thank you for contributing so much with the work that you've done, the research, and your books as well. Is there anything else that you would like to share with our listeners?
Keep going. And if you don't feel that you can, that's okay too. Just remember you're a beautiful human being in a difficult circumstance, and that things will be okay. I don't know what okay means yet, but things will be okay.
Beautifully said. So where can people find you and learn more from you and read your 10 tips?
Okay, partnersinfertility.net.
Wonderful. Well, thank you so much, Dr. Simmons. Such a pleasure having you on. Such an honor. Thank you, and have a wonderful day.
Thank you so much, Dr. Amy, and thank you for the beautiful things you do.